Hi everyone, good morning and welcome to the morning transform session at 10 a.m. And today we have a very important topic. Me and Dr. Deepthi are going to talk about the importance of how to, be thorough in PYQs and PYTs, especially for your INI-CET paper.
Right. So, a very, very good morning to all the dear students. And today is a special episode that we're going to dedicate to INI-CET preparation. And not just preparation, today we are going to focus on how should you go about solving the PYTs and the PYQs. So anyone who's even starting their preparation now for INI-CET, what we are going to tell you today is going to be very, very useful and very, very effective as well. Okay. So the first thing I want to start with is that when you begin your preparation, you have to know how INI-CET is different from NEET PG exam, है ना? सबसे पहले हमें insight होना चाहिए. So today we will first talk about what is the insight that we need to know, as in how is it different from NEET PG, and therefore how to begin when we have to begin this preparation, because some of you might be wanting to appear for it after your NEET PG, as an option, as a opportunity, right? And some of you would be appearing for it as a target because it's a good landmark. You need to keep working hard, appear for the exam, see how much you've improved, and so on, right?
Hanji. So what we want you to understand is that when we look at the papers, and we also have to look at the recent year paper patterns. That See, the most important thing that I want you to understand first of all is that in your INI-CET paper, you will have first, second years will contribute to your 50% of the paper, third, fourth year will contribute to 50% of your paper. Okay. However, when we look at NEET PG, this distribution becomes 40% first, second year, 60% third, fourth year. Now, why this is important is, and I'll also give you an example also. This makes 100 questions from your first, second year, 100 questions from third, fourth year. Here it is 120 questions from third, fourth year in NEET PG, 80 from first, second year. As a result, the shorter subjects, skin, anesthesia, radiology, psychiatry, orthopedics, they tend to get a little squeezed in your INI-CET. Every year in INI-CET, some short subject takes more questions than others. For example, in the last year's INI-CET, radiology was the clear winner out of the short subjects, and we had like more than 10 or 12, 13 questions in radiology. For that simple reason, if you see the how we keep titrating our courses, I have preponed the radiology discussion which was happening a little later to radiology TND will now happen in 1st of October, I think. So I am we keep working on it. So I'm going to help you with the I think a lot of bachon already have picked it up. So second thing I want you to understand is when you're preparing for the exams is then you start with your first second year. That is why we have scheduled first second year subjects in our live TND earlier so that you have the edge when you are appearing for the November exam.
I just want to add two things. Definitely, yes, we all know that first and second year have a slightly higher weightage as compared to NEET PG. लेकिन दो तीन और सब्जेक्ट हैं जो आप मेरी बात ध्यान से सुनोगे. From the third year, ऑफ्थैल इम्पोर्टेंट है और थोड़ी सी डिफिकल्ट, हाँ, डिफिकल्टी लेवल हायर होता है इन INICET व्हेन इट कम्स टू ऑफ्थैल. द नेक्स्ट डिफरेंस इज PSM. PSM में देयर वाज अ फेज जब बहुत ज्यादा बायोस्टैट्स आता था, देन देयर वाज अ फेज जब बायोस्टैट्स नहीं आ रहा था, बट अगेन अब बायोस्टैट्स फिर से आ रहा है, राइट? सो दीज आर की एरियाज दैट दे फोकस ऑन. फ्रॉम द फोर्थ ईयर, सर्जरी हमेशा मेडिसिन से ज्यादा अच्छा आएगा, लेवल ऑफ क्वेश्चंस भी हायर आएंगे और क्वालिटी और क्वांटिटी भी ज्यादा आता है. ओजी इज ऑलवेज कांस्टेंट. 18 से 22 MCQ. It doesn't go higher than that. It doesn't even go lower than that. So it's a good chunk. And from these short subjects, radiology and dermatology always seem to have a good chunk maybe in an integrated manner, but yes, they do tend to focus on these. So, ensure that among your third and fourth year subjects, these are your target areas. At least they are not your weak zones, and at least you do one good revision for these subjects. Now, once we have given you an insight on this, the next very important thing that I'm going to talk about, and Dr. Sumer is simultaneously going to write and add his points on it. When you begin your journey, you might have already appeared NEET PG, you may have done well, you may have done average, you may have done below your expectation, it doesn't matter. The idea is when you have time, when a restricted time is there for an exam, we also have to do smart study. So now the first thing is we are going to focus on INI-PYTs. सब बच्चे को ये इंसाइट होना चाहिए कि पीवाईटी कौन से हैं, क्योंकि INI-CET का डिफरेंस क्या है कि इन टॉपिक्स में इट गोज टू रियली डीप लेवल, right? And they will ask you every tiny detail. So for this, I want everyone who's starting your journey to go through the back to basics PYT PDF section. I have already shared approximately 6 subjects ka PYT PDFs, and we are rapidly going to put the others as well. So, whenever you start the subject, please go through the PYT PDFs first. Not only are they giving you answers, they're giving you distribution as well from various topics, what all subdivisions are asked, what all things are asked. So there is a analysis in those PDFs as well, and it gives you a good insight कि इतने बड़े subject में what should be my first priority, right? Do you understand, everyone? Then the second thing we want to tell you is, since first and second year subjects are more in weightage, this is why when we are starting INI-CET TND, so we have started from 1st of September only, we are first catering to your first and second year subjects in INI-CET TND. Please use the INI-CET TND to give you the edge you need in your NEET paper. We usually have even direct questions from INI TND. It is one of the resources which really gives an edge, which tells students what is the knack of solving that particular thing that INICET is asking. Okay?
So I'll add two things to what Dr. Deepti has already mentioned, and I want you to keep this in mind. Look at this video again also. In the back to basics sections on the DAMS app, there is a separate section on anatomy called as dissection based lectures or cadaveric images. You will get direct 2-3 questions from this set of lectures. You cannot miss them. Please see them if you have not seen them so far. It is a must do for INI exam. INI exam mein, when they ask anatomy, they ask cadaveric images. Second thing what we want you to understand is, like Dr. Deepti has already mentioned, INI-CET is a predictable paper. They tend to ask on this similar topic, only the choices are more confusing, and it is a PYT based paper. So you have to look at the PYT PDFs from your back to basics. In the revision courses, there is a course called as INI PYQ ka BAP, where teachers have discussed last 3 years of papers of INI-CET and discussion, and also
in the INI PYT PDFs, we are covering last 7 years. In the PYQ ka BAP, we are focusing on usually 3 years. In some subjects, we may have gone a little beyond, maybe up to 5 as well. But usually it's 3 years in PYQ ka BAP, and in the PYT PDFs, it is 7 years.
And although it is less relevant nowadays, but it is always a good idea. In your DAMS question bank, there is a separate folder in every subject for AIMS 2014 to 2018 papers. Sometimes 1 or 2 questions just fly out of them. It is just a lottery kind of a thing. That is why I always recommend that if you are very serious about INI, it is a good idea to give your time to these papers. But it is more of a lottery thing. It is like not a guarantee कि जैसे I see some people on social media keep saying कि so 2014 में से क्वेश्चन आएगा ऐसा कुछ नहीं है. But sometimes it flies out. So this is there in your DAMS question bank. This is what are we trying to cater to is the previous year topic analysis. Also, biostats, like madam has already mentioned, has a love-hate relationship with INI-CET. कभी कभी बिल्कुल नहीं आता, कभी आता है तो ऐसा आता है कि किसी ने मतलब हालत खराब कर देता है. तो biostats should be seen before your INI exam. Microbiology has a very infectious disease approach in the paper, very integrated approach in the paper. You They have to be thorough in how to deal with the infection, not only diagnosing, also managing. So you have to look at the complete spectrum, how the patient will present, what will be the microbe, how do you identify, how do you treat. If you start thinking in this language, it makes it more easy. Also in biochemistry, they go for some inborn error of metabolism. Sometimes they go for some genetics questions, but again, off and on. Sometimes there is genetics is very tough. Sometimes the storage diseases, inborn errors are very tough in the paper. Sometimes they are not there, but it always is good idea to be safe and look at the genetics section as well. It is very important.
Right. So I see some of the queries, but see, this is the path that we are talking about for students who are planning to give November INI-CET exam. I see a query like, if I'm not giving the November exam, then should I follow this or should I follow the schedule that we have given? Please follow the schedule that we have given you for your next year exam. There are two things that we have shared. So there was a 5 phase preparation strategy that I have shared previously for your next year exam. And then we had done the detailed strategy on how to use all the resources in these 5 phases for next year May INI-CET और जून नीट पीजी. अभी हम सिर्फ INI-CET नवंबर की बात कर रहे हैं, and that is why the approach is a little different, because we want you to go in a reverse manner, right? Have an idea about the PYTs, have an idea about PYQs, ensure that these topics you do in good depth, not just this was the PYQ, this was the answer. No, these topics have to be done in good depth. Okay, so very, very essential, and it's a good idea to do them at the beginning of your preparation once, and then quickly cover the mission INI-CET and PYQ ka BAP also towards the end. Okay, सो प्लीज हियर मी आउट. मैं बोल रही हूँ एक बार शुरू में भी करना है, तो INI PYT PDFs you have to see and the PYQs you have to see. Based on that, you plan your revision in a way that these topics are given priority and they are done in depth. Along with it, the INI TND will give you the edge that you really, really need in solving the MCQs, in revising the other topics as well. In the end, I definitely want you to all do the mission INI-CET, which is in your revision course, and maybe see the INI-CET PYQ ka BAP once again. Because when we do PYQ ka BAP, we just don't tell you the answers. We tell you what are the other questions asked from it and what are the probable new questions that can be asked from that topic. So we cover both, and that is why I said PYQ ka BAP is something you should be doing once again towards the exam along with mission INI-CET. Okay?
So, along with the preparation, you also have to give tests. So, what I've written on the side is that you every 7th day you give a grand test, 14th day you give a INI-CET mock test, 21st day again grand test, 28th day INI mock, and you repeat the same cycle in the next month also. You also register for the DAMS INI-CET CBT, which is going to happen in October. The last date to register is approaching. Don't miss out on registering so that you can give the real exam in the exam pattern. Now I will add one more word for you. In addition to this, in this paper, it is not going to be about the topics. It is going to be about the choices and variety of questions in the paper. Last 2 3 papers we have seen there has been a lot of focus on match the following.
No, and multiple completion. More important.
Match the following,
These two
yes,
are very, very
and
important.
multiple combination type of questions. And one or two sometimes they push in assertion,
Reason assertion.
reason.
But reason assertion is only
Other than
one mark
that,
question.
the image-based questions and single-based response questions are anyhow there in any other paper as well. So what are we going to do is, I want you to remember that if I am not looking at it, then what will happen is I will be little confused in the exam. That is why if you noticed I said grand test, INI mock, grand test, INI mock, so that you are used to the exam pattern. You have to tell yourself that I have to know whatever I know, I need to understand clearly. Matlab, trying to do too many things without knowing them, you will not be able to decipher them in the exam because the choices and the language of the paper will be confusing. At least know what you know. And that is where Mission INI-CET is very important. In the Mission INI-CET, in your revision course, teachers have taught the important topics, not just mentioned. ये बहुत फर्क है. बहुत सारे लोग बहुत सारे टॉपिक यूट्यूब पे मेंशन करके चले जाएंगे, तुझे वो बाद में बोलेंगे मैंने तो बोला था आया था, but you will not be able to do it. Mentioning the topic is not enough, it has to be taught. So Mission INI-CET is going to be the game changer for your PYT based topic. Last papers we have seen, it contributes to biggest strike rate in the INI exam. Don't miss it. It is there in your revision course in the DAMS Alpha app. Just go to the revision courses in my study section. You will find the Mission INI-CET videos, which I would strongly recommend considering the complexity of the questions and considering the complexity of the choices.
Okay, now please listen to very carefully. Recently, what we have seen is, as far as INI-CET is concerned, per se, if you look at the topic and the difficulty of the paper, it is not difficult. But hear me out. The way things are asked, the overall paper becomes difficult to score. Why? Especially if there are lots and lots of multiple completion or combination questions. Now, what happens is, if there are four statements in a multiple completion question and you are very sure about one is correct, you still don't get the marks, because you get marks in single best if one is correct. But in multiple completion, every option is an MCQ by itself, so you have to know about all options. And any option which is even closely true has to be included. It does not have to be exactly true. You will say, oh ma'am, this percentage was one level above, one level below, so I didn't include it. No. In multiple completion, students find it difficult, especially INI-CET paper, because of the multiple combination type question, where they ask things in great depth. You need to know the topic in depth. You need to know the entire topic. फॉर एग्जाम्पल मैंने देखा एक्टोपिक प्रेगनेंसी इन्हीं सेट में हमेशा आता है, इस बार भी आएगा. क्वेश्चन एक ही आया, मगर उस क्वेश्चन में ऑल फोर ऑप्शंस वर अबाउट डिफरेंट थिंग्स अबाउट एक्टोपिक. वन ऑप्शन वाज अबाउट डायग्नोसिस, one option was about treatment, one option was about findings, and one was about clinical presentation, which means you had to know the entire topic of ectopic. It was not just try and remember the medical management criteria. No. So this is why it is essential, and that's why I said, when AIMS or INICET is going to ask you a topic, it is going to be in depth, and that is basically because of multiple combination questions, where knowing one option is not enough, knowing two is not enough. You have to know about all four, and anything which is even closely correct should be included in your answer. Okay, but yes, you need to spend time on the options, see how they are created, and then approach them. Okay.
So I have written a lot of questions in the screen side by side. I'll answer all of them. Sir, should I appear for INI-CET? Yes. Sir, but I have not prepared. No matter. I said default yes. If you're eligible for the paper, you should be appearing for it. If you either you win or you learn something. It is always a good idea to appear for all the government exams that you're eligible for. It gives you a lot of exposure. And to me, the best thing I get as a teacher is, even if you don't qualify INI-CET, you come back and say, sir, मुझे विश्वास हो रहा है कि आप ठीक कह रहे थे, आपने जो पढ़ाया था वो आ रहा है पेपर में, and you strike it harder in the May paper. नहीं तो इधर उधर सामान इकट्ठे करते करते कई महीने निकल जाएंगे. Every time after the exam happens, the students come back and say, boss, आपने ठीक बोला, ये आएगा एग्जाम में. So I want you to give the paper. It will give you the confidence that you're reading it right. Second things that I want you to remember will be, practice aggression in the exam in your GTs. Recently, I was talking to a student who attempted 160 questions. I said, boss, तू ज़्यादा कर. And abhi, he sent me a message on Telegram or my Instagram saying, sir, I did 165. I said, और ज़्यादा कर. It is less. So, sometimes you might be too defensive. So, aggression in the exam is important. We'll talk about it closer to the exam also. You need to practice the art of elimination in your grand tests and in your TND papers also. Lot of you are having a fast track TND coming up. I think you attended it yesterday. some of you did not attend the TND के सर अभी मेरे को आता नहीं है तब भी देना है बेटा तब भी देना है because in the real exam also you need to test your residual knowledge again and again. You have to make sure that you look at the mark for review options. If you mark for review, don't save it, it will not be saved. In the assertion reasoning type of questions, we read the assertion and reason as separate statements.
Yes. Individually
And
see them true
we
or false.
see if they are true or false, and then we see the relationship between them.
Yes.
In an image-based question, we see the choices first, then we go to the image. In the multiple combination type of questions, I just wanted you to see these options. A plus B, A plus C, A plus B plus C, A plus D. As soon as you see these options, if I was in your place, I will ignore A choice altogether. ये तो ठीक होगा ही ना इसको पढ़ के भी क्या करूंगा you understand you can save time by practicing these kind of questions if there is a option which is appearing in all the options probably there is no need to look at it look at the others that will help you to rule out now for example if you see D in this options if I now see read the first I need to look at D if D is correct then automatically this is the answer there is no need to look at any other thing you understand it will save time if you don't practice this smartness in the paper you will read the question you will read the options then again read it again and you will be entangled and confused.
Okay. So also, coming to now the volatile things. Now, sadly, yes, there has been a rise of factual questions on any in the NEET exams over past 5 or 6 sessions, right? So over past 2 to 3 years, the number of one-liners in NEET has increased a lot. So you will hear people saying, that NEET is the new NEET PG, NEET PG is the new NEET, right? So now to make things easier for you, there are a couple of places where we have put all the volatile and important things for exam at one place. And yes, this is the DAMS alpha cards. You will find them amazing revision tools for any subject. You can do it on the go. It is all based on what our faculty has taught, right? And you will realize that we have removed the hard work from your side, taken to our side, and given you it on the plate. So, yesterday I have added the alpha cards of obs and gynae, and I assure you that they will really, really take the anxiety away. We have put the POGs at one place, the investigations at one place, the signs at one place, the scoring systems at one place, the images at one place, right? So we have done that for you so that you don't spend time making it. We have made it for you. So whenever you want to revise these factual things closer to the exams, please open your alpha cards. We will make it a class apart. We will ensure that you have the faith and the confidence कि यार ये end में ये volatile तो मैं यहाँ से कर लूँगी. Yes. So we will keep bringing more and more. We have already shared the alpha cards of ENT, anatomy, ophthalmology. They're wonderful. Medicine, we have put so far endocrinology, we'll share the others, and we have put obs and gynae as well. So we are working simultaneously on the PYT PDFs, and we are also working on the alpha cards. Okay?
And let me add a few things from my side also. In the radiology B2B, I have added 2 videos. One is called as A to Z Radiological Science. This is only made for INI-CET. INI-CET, they are recently asking one-liners, factual questions. I have added a single video of A to Z of radiological science.
It's amazing. Please go through that video.
And I have added a short video on intervention radiology procedures. We have seen in the past that in INI-CET they asked aneurysmal coiling, or maybe they might ask TIPS, which is used in portal hypertension. Sometimes they ask about, ERCP or any cholangiogram. So I have included a small section on intervention radiology and on A to Z of radiology science. So what we have done is I have tried to evolve the course according to the exam pattern. Classically, we believed that INI-CET would be more conceptual, but sadly it is not true. There is a lot of factual and one-liners questions asked in the exam. This takes me to the next question also.
Very theory intensive, actually.
And also, I just want you to, notice this thing that in INI there are 2 papers happening. November INI-CET, May INI-CET. It is a tradition in AIMS from the last 15-20 years that the May paper is little bit more theory intensive, and November INI-CET has more internship focus on it. This is the tradition in AIMS. The November exam, they might put some questions on some, basic surgical devices like Foley's catheter, Ryle's tube, chest tube, and general surgery procedures, sutures. They try to check how well you have done your internship in the November paper in one or two questions, not more than that. When we say that focus is there, it means one or two questions. It's not like the 100% paper will be like this, but there is a slight variability here. Here they tend to put more fact, more theory in the
Yeah.
May paper, just to see how well you studied in your next 6 months if you were dropping. So this is the traditional distribution in the November exam. Also, I want you to know that the INICET paper always happens on time. It does not get postponed. The
Mhm.
counseling happens on time. It is, even if you are qualified for this year's NEET PG and you are going to take your PG in the NEET through NEET, I would always recommend, please keep preparing for INI-CET. It is good idea to keep your options open. You never know which court case delays the INI, the NEET PG counseling. We have seen this circus happening through, uh, in front of us for last 5 years now. Last 5 years, I
It's
have never
just
seen a
not
NEET
coming to
PG
an end.
paper happening on
Or
time,
counseling happening
counseling
on
happening
time.
on time, and things like that. So I would always say, boss, till the time you have the joining letter in your hand and you really join that college and you're happy in the first week, keep studying for the INI paper because it is happening every 6 months.
Okay, so GT frequency for INI-CT, we said the minimum now is once a week. And what we have asked you is to alternate GT with INI-CT mock paper. And in between, you will be also giving your CBT, INI-CT, CBT. Okay, so one week give a grand test, other week give the INI-CT mock so that you stay in touch with all types of questions in terms of different types which are asked in INICET. Time management is taken care of, and you are able to identify the subtopics that you are weak in, right? So this is broadly what we would definitely want all the students to know, especially about INICET. Okay, also, I just see a query there, and my bacha has put it, I think two to three times now, doctor, the live app class schedule. So probably you don't know, bache, so please go to my course, in your my study section from the bottom, select app live. Okay, so select app live, and like this. No, it's and in the app live, once you select it in the my study, you will see my schedule
Right.
right at the top. So you will get the entire month ka schedule and even the months forward. So next 6 months ka schedule bhi usme dala hua hoga, right? So go to my study, then go to app live, and then at the top itself you will see the schedule section where the entire schedule is put. So there, even when your fast track is coming, that will also come. Okay? So all that is included in your app live, the schedule will be there. The entire 6-7 months ka schedule is already uploaded for you. Okay?
And for those of you who have attended our face-to-face classes would remember that, this is something we do in our classes also. Whenever, we are doing together, some orientation, madam would do the talking, I'll do the writing. So we try to do the same thing on the YouTube also, so that, because we want to hammer it into your head. Some things we want you to know, because some people will say, sir, CBT I'm giving so many grand tests on the app, why should I give the CBT? You are not following the value of giving the paper in a computer center. It makes you feel so confident that you've done it already. Many times the centers that you will get in the damn CBT will be your real exam centers. We don't do it in our classrooms, we do it in the actual exam centers. It is a very important experience. अब मेरे को सभी बच्चे चैट में बताएंगे, असली एग्जाम के अंदर, डू यू हैव हाई क्वालिटी हिटैची एयर कंडीशंस एंड
No.
एप्पल कंप्यूटर्स? All the hi-fi bachas will tell you, they do
The
do
keyboard
do
good
do
function,
do
the
they take your
screen
paper?
keeps
Yes.
flickering.
Do they have high quality air conditions, high quality computers, very polite, you know, Vistara air hostess like invigilators. No, they will be talking to each other. They will be rough. The fans will be
You'll be
making noise.
touching,
The computers will be slow.
and people around you might even be sleeping.
Yeah, I can see some of you who people who have given the paper are able to understand. People who have not given the paper are in their imaginary world, sitting on their iPhone in their bed with the AC on, टीवी चल रहा है सामने कर रहे हैं, मैं एग्जाम की तैयारी कर रहा हूँ. ऐसा नहीं होता बेटा. असली जिंदगी में आ जाओ. असली जिंदगी में वहाँ शोर होगा, पंखे नहीं चल रहे होंगे तो आवाज कर रहे
कंप्यूटर
होंगे.
चल जाए वो बहुत बड़ी बात है.
Or I have seen this year many people had restarting of the computer.
Yeah,
Many
yeah.
people had
We
restarting.
suffered a lot.
So I
This
would
year,
strongly
students,
recommend that please register for CBT. I am saying it again and again because
to get
मुझे
accustomed.
मुझे पता है कि तू रजिस्टर करना चाहता है लेकिन तू एक दिन बाद आएगा मेरे पास. And every year when we are in the next morning transform, everybody will say, sir please एक दिन के लिए और खोल दो. मैं नहीं खोल सकता because I have to book the computer centers in advance. Please register today. Don't wait for the last day. वो ऐसे मत करो जैसे सेल में होता है आखिरी दिन जाके खरीदना है. ऐसा ना करो. Please make sure that the CBT registration should be done on time.
Yes, absolutely. You know, they will really be harsh. And इसलिए और कोई बात नहीं होती. But when the circumstances are not optimum, क्या होता है कभी कभी we get baffled by it and we lose focus. The idea is to train so well, to have the inner peace so that your focus is, not going to shatter at all, because you need those 3 hours in the best of your concentration, in the best of your focus. We don't want any smallest thing to distract you, to trouble you, right? Or to shake you. Yes? So it is essential to get the feel of the real exam and know that it is not just the syllabus which is difficult, it could also be suboptimal circumstances, right? Okay.
And lot of students they keep asking, sir, if I'm joining DAMS now and only want to appear for the November INI, what are the two things that I should register for? Those two things are app TND on the DAMS Alpha app. It has a short 3 month subscription, and INI-CET CBT on the DAMS app. You can register, and a day before the exam, you will get your hall ticket in the app itself, and you go to the exam center and give the paper in the
Dr.
exam
Sumail,
environment.
I have a query from all on behalf of all the students because they have been asking me. And the query is, will we be doing the INI-CET marathon this session?
And
Yes.
madam, when you
Yes.
look at me and ask like this, your wish is my command. We will definitely do INI-CET marathon revision on YouTube for all the bachas.
And you know, when we say this, what we mean? We mean serious stuff. You are going to get things from it just like it happened this year in INICET and this year in NEET PG. The marathons were a class apart and they gave you the real edge that you needed. I hope मेरे को recall ना कराना पड़े, but yes, the images that I covered this time in NEET PG marathon, so many of them came directly in your real exam. So we know what the examiner is thinking like, and we know what they would want to ask and how they would want to ask. So we will be there doing the special marathon session for this November as well. We'll be there for you. We will do whatever we have to do. That's a promise. We won't step back. We only try and raise the bar. Also, I've been getting a lot of requests to allow students to refresh their DQB because
We'll
yes,
put it in
I
the
have been working on the DQB and I'm telling you, we have been adding new questions, clinical vignettes, image-based questions, previous year questions. So yes, there is already an option to reset, but Abhi, I am not sure if something that you have bookmarked will be saved or not. So we are working with the tech team on that somehow we should not lose your bookmark. So we are on it. And then, yes, you will be able to reset and you'll be able to see all the new questions that we are putting in the DQB to make it, yes, a level higher. Okay. So it gives you, because students have been loving, I've been giving them targets from my DQB and they said, ma'am, the questions were really nice with tricky options, but not difficult topics. That's how the real exam is. So I will do that. You keep following my targets and I will keep guiding you on what to be done next. Okay?
Okay, and so as I've already said, we will do on YouTube INI-CET marathon closer to the exam. We will announce it. Only thing I wanted to warn you against is that you please, when we are doing our DAMS INI marathon, don't look here and there. Our damn scam is looking at you. You might be in the next Coldplay concert. Please don't do that. Reason I'm saying is many people will start doing their own video things on the YouTube at that time, but we have massive strike rate from the marathon. And even if you attended the NEET PG marathon this year, if you remember, uh, every one of the questions that we discussed in the marathon, out of that we had a huge strike rate in the real exam. Don't miss it.
Okay, so Sapna is asking, ma'am, by DQB, you mean subject-wise DQB? Yes, in the subject-wise DQB, we have added new questions. We have created better version of it with better explanations. Thank you, Jamin. He says the new explanations are awesome. And also, yes, underneath every subject. So for anatomy, there is a subject-wise DQB, and then there is an anatomy PYQ section just below it, where we have a separate subsection for NEET PYQs, NEET PG, and so on, FMG PYQs. So तीनों अलग से हैं. उनमें भी we keep adding all the new PYQs, right? So every year and after every exam, even the PYQ section is updated. New ones are added with every new exam. So you will find even questions of the recent exam in the PYQ section of the DQB. And in case you want to practice the entire paper, go to your test series. In your test series, there is a section called as PYP, previous year paper. And you will see कि INI-CET का previous year paper. Already I have shared 3 complete PYPs in your test series. So if you want to do the complete paper, you can do that as well from the test series section. Okay?
एंड एक बच्चा कह रहा है सर रेडियोलॉजी के लिए भी कुछ और हेल्प करो. सो रेडियोलॉजी एक्चुअली फॉर all over India student, I'm doing a app live class all across the country, and I'll meet you all Monday again at 5 p.m. and we'll continue discussing with the bone X-rays that we started in the last class. In 1st of October, I'll be taking a test and discussion session. I'll try my best to cover all the topics in the TND also. That is an app TND on 1st October. And also, there is a Telegram channel by me called as Radiology Unplugged. If you're not following it, please follow it. Every day I put a quiz, and I'm sure you know Madam's
Okay.
Telegram already.
Now last announcement. आप लोगों को ऐसा लग रहा है कि हम आराम करते हैं, तो आपको बिल्कुल नहीं लग रहा है. Believe me and Dr. Sameer are always on our toes. And it's not just our toes, our mind is also going, right? So we have multiple things planned for you. And as we promised, we'll never let you be alone. Never without targets, never without our support. So yes, आप जो मुंह से निकालते भी हो ना, हम कोशिश करते हैं कि हम उसको कर दें. हम कोशिश करते हैं कि हम वो आपकी जादू की छड़ी बन जाएं कि आप बोलो कि ये कर दो तो हम कर दें. और आपने अभी बोला मैम न्यू ट्रांसफॉर्म 10x टारगेट्स. आई प्रॉमिस आई एम गोइंग टू स्टार्ट देम इन October. I am already making the new test papers for Transform 10x mini test, and they will all be based on INI-CET PYTs. So new set of test papers are already in the process. I'm working as the academic head and I do my duty very truthfully. I'm in the process, and by September end, we will start with the new Transform 10x targets and new mini test papers based only on INI-CET PYTs. Okay?
And the material in the app is like a gold mine. If you use the DAMS app to the fullest, you will find every question that you appear for in every exam will be from it. Not only in India, when you go abroad, you will find a lot of things that we are teaching you. Even your professors abroad will also be asking. A lot of my students who are right now practicing in America or in different countries like Australia, Germany, whenever they come back and say, "Sir, जो concepts आपने बताए वो वहाँ पे भी काम आते हैं." So my again request is focus on your classes, Don't miss out the concepts in your class notes. Don't miss out the basics.
And don't worry about revision. We will have it all sorted. We know what you need and when it has to be given, right? So we know when to push Mission INI-CET for you. I know when to bring in the flashcards. I know when to tell you now switch to DVT mode, right? We will be there constantly asking you to change your gears when required. बट जब हम बोलते हैं अभी इस गियर पे काम करना है तो फिर कंसिस्टेंटली उस गियर पे काम करना है. जब हम बोलेंगे कि गियर बदलना है तो फिर गियर बदलना है, राइट? सो अभी कंसिस्टेंसी से सितंबर का महीना लगाओ टू रिवाइज योर कंटेंट. डोंट रन आफ्टर स्मॉलर थिंग्स. I will tell you they have to be done in October and we are already preparing everything for you. We are preparing the alpha cards for you. We are preparing the Mission INI-CET for you. We are preparing the transform test for you. We are preparing the marathon for you. सब करेंगे, लेकिन समय आने पर हर चीज की वैल्यू तभी होती है जब उसका सही समय हो. दैट्स व्हेन यू रीप मोस्ट बेनिफिट्स ऑफ इट. अभी सितंबर, मुझे कोई कॉम्प्रोमाइज नहीं चाहिए. सब बच्चे बेस्ड ऑन दी PYT PDFs जो INI-CET के टॉपिक्स हैं उनको इंटेंसिवली रिवाइज करेंगे. TNDs को यूटिलाइज करेंगे टू गिव यू द एज इन MCQ सॉल्विंग एंड एप्लीकेशन ऑफ कॉन्सेप्ट्स. Leave the October to me. I will be after your life. Okay, don't worry. I know when to hit you hard, when to counsel you, when to sympathize and empathize with you. We will do the right things at right time. सही समय आने पे सही चीजें करेंगे, ठीक है?
और कभी कभी डांटेंगे भी, ठीक है? अभी अभी के लिए आई थिंक वी हैव कवर्ड एवरीथिंग नीडेड इन एनाटॉमी. डोंट फॉरगेट टू लुक एट द कैडेवरिक इमेजेस फ्रॉम योर बैक टू बेसिक्स. इन रेडियोलॉजी डोंट फॉरगेट टू लुक एट द A to Z रेडियोलॉजिकल साइंस, ऑब्स एंड गाइनी अल्फा कार्ड्स, DVT and your Mission INI-CET will help you a lot. And I always believe it strongly that INI-CET as compared to NEET PG is more predictable. INI-CET is more predictable than NEET PG. Topics that you will see in the paper, okay beta, topics that you will see in the paper will be the ones that you have already seen. It is only going to be about ability to navigate through the choices and the time management will be the key. That is why your testing is also equally important. So we have stressed upon both. If you have not attended the full video today, go back and see it again. I have talked about all the aspects, including how to do the PYQs, the tests, the topics, and how to revise. Trust them fully and keep following it. After the exam, result is in the hand of the Almighty. But after the exam, I promise you will come back and say that ये जो इन्होंने बताया वो आया पेपर के अंदर. Use the TND in the September, and the final 15 days will use the DVT and the Mission INI-CET.
Alpha cards, yes, they are in the back to basics section. और अगला alpha card आएगा microbio का, where we will do the hard work for you. All media, all volatile things, everything sorted out. We know how to make a difference and we will do it. We will keep doing it. We will try our best, okay? So that we are just not a saman that you have to buy, okay? I don't want to say that you can buy us. No, okay? You can't buy us, but you can love us and you will have us, okay? So love is what will make you have us. We are not something or a commodity that can be bought. ठीक है? तो मेहनत करेंगे, हम अपने आप को उस लेवल पे लाएंगे where you attract us because of your love. Okay, so we will prove that we will be there with you in the best of our ability.
And finally, there is a slight thing that I wanted to mention in continuity with what Madam has just said. Sometimes a student will come to me and say, "Sir, I'm a user of this kind of a resource." I don't even call them resource. They are user. So मैं बोलता हूँ भाई मेरे यहाँ यूजर मत बनियो, मेरे यहाँ स्टूडेंट ही बनियो, ठीक है ना? मेरे यहाँ तो बैठ के पढ़ेंगे और हम चाहे क्लास में पढ़ेंगे, चाहे ऐप लाइव में पढ़ेंगे या ऐप रिकॉर्डेड में पढ़ेंगे, लेकिन स्टूडेंट टीचर की तरह ही पढ़ेंगे. यूजर मत बन, अभी उतना बड़ा नहीं हुआ. दैट इज ऑल आई वुड से इन द एंड टुडे. वी विश यू ऑल द बेस्ट and we'll meet you on Monday again in the daily transform session.
Yes. So take care, everyone. We will see you on Monday. Till then, लगे रहो दुनिया का नारा लगे रहो. ठीक है? So we will work hard and अपना time अपन खुद लाएगा.